Well, with me now is the American Dr. Frank Ambrosio, who's going to be talking to MPs and peers today about medicinal cannabis. You're a supporter of the use of medicinal cannabis.
Absolutely.
Do you think there's any question, because we understand the British government's going to have a further inquiry into this, that cannabis does have medicinal benefits?
I don't think there's any question. I have spent an enormous amount of time not only researching cannabis, I've reviewed the literature, and I have, based on my clinical practice, I have no doubt in my mind that cannabis is medicine. It is used for a variety of neurological disorders, Parkinson's, seizures, dementia. We have used it for insomnia, anxiety, depression. We have used it to replace opioids. We have used it for some very unusual diseases like Lou Gehrig's disease. We've used it for trigeminal neuralgia. There's of disease processes.
And in the US, what's the state of access to medicinal cannabis?
Depending on the state that you're in.
Yeah.
So I'm from California, where we've had legal cannabis medicinally since 1996, so 22 years of medicine.
I mean, how many states have got it now?
I believe we're up to 32 have it at least medicinally. There's 7 that have it recreationally.
What is your, I mean, I know it's a related subject, but what is your feeling on recreational legalization?
As much as I would love to believe that the plant should be free and people should have the choice to do whatever they want in life, I think a more measured approach, having physicians involved in the prescription as well as in the monitoring of patients using cannabis is a much safer and long-term effects can be better judged if a patient is under physician's care.
How do we get into this model? Because, of course, in the case of cocaine and heroin, both illegal for recreational use, if one can call it that, we do use products from that in medicine around the world.
Right. And well, the cocaine is used, basically has been used in the past by ophthalmologists in order to numb the eye before they would do surgery, as well as
Coca-Cola originally.
Right. I mean, the problem with cannabis is that it's such a complex plant that, and it's been demonized with such negative propaganda for so long that it took a long time for us to even figure out how it worked. We didn't even discover that our bodies had an endocannabinoid system that is able to utilize the phytocannabinoids in the plant till 1992.
So do you think we're going to change, and you're going to say to MPs, get on with it?
Well, I think that to not at least move the ball in the direction of exploring cannabis as medicine is doing an enormous disservice to the patients who need it in the United Kingdom, especially when the United Kingdom is one of the largest exporters of cannabis.
Okay, Dr. Frank, thank you very much indeed. That's all that politics for today.